is the Rehab Radio. Today, let's learn about Thoracic Outlet Syndrome. Let me paint a picture for you. Imagine a narrow tunnel just under your collarbone, crowded with nerves and blood vessels. That spot? It's called the thoracic outlet. And when there's a traffic jam in there, you get what's known as Thoracic Outlet Syndrome, or TOS. Now, you might be wondering, why does a little compression here matter? Well, those nerve trunks, the brachial plexus and major vessels, like the subclavian artery and vein, all squeeze through this tight space. When anything crowds them, muscle swelling, an extra rib, even poor posture, you'll feel it as pain, tingling, numbness, or weakness from your neck down to your hand. Here's a quick analogy. Think of your arm as a busy city, and the thoracic outlet as the main highway tunnel. Any blockage in that tunnel causes traffic jams, except here, it's nerve signals and blood flow that get stuck. So, what are the first clues? Something's wrong. Typically, unexplained pain in your shoulder, arm, or hand. Sometimes with a cold or blue hand, or fingers that tingle like you've hit your funny bone and it doesn't go away. Recognizing these early signals is the first step to tackling TOS before it causes permanent issues. Stick with me as we dig deeper into the types of TOS and why figuring out which one you have unlocks the right treatment. Now, not all traffic jams are created equal. Thoracic outlet syndrome actually comes in three main types, each with its own troublemakers. The first, and by far the most common, is neurogenic TOS, accounting for about 95% of cases. Neurogenic TOS means the nerves specifically, the brachial plexus, are under pressure. Picture trying to text with gloves on, clumsy, weak, and frustrating. That's what nerve compression feels like: numbness, tingling, weakness, even muscle wasting in severe cases. But what about venous TOS? Here, the subclavian vein gets squashed, not the nerves. Suddenly, your arm feels swollen, turns blue, or gets tired fast, much like a river that's dammed up and can't flow. Worst case, you might develop blood clots. The rarest culprit is arterial TOS, just 1% of cases where the subclavian artery loses its space. Imagine a garden hose clamped so tight that water barely trickles. In your body, that means cold, pale fingers, a weak pulse, or even a pulsating lump near your collarbone. So, if you or someone you know experiences these symptoms, it's critical to identify which form of TOS is at play. Remember, nerves, veins, or arteries each demands a different approach. Let's dive into the why. Why do some people develop thoracic outlet syndrome out of the blue? The answer usually comes down to anatomy and lifestyle, sometimes a bit of both. Some folks are born with anatomical quirks like a cervical rib, which is an extra rib above the first, or elongated transverse processes, those bony wings on your spine. It's a bit like having an unexpected speed bump in that already narrow tunnel. But it's not all genetics. Traumatic injuries, think whiplash, car accidents, or a broken collarbone, can change the landscape inside the thoracic outlet, making compression more likely. Then there's repetitive overhead activity. Picture a swimmer constantly reaching up. Those repeated motions can bulk up the scalene muscles and shrink the space even more. And don't overlook posture. Slouching at your desk or rounding your shoulders can tilt the collarbone and rib closer together, pinching what's in between. Even pregnancy can make tissues swell, adding to the squeeze. So, the big takeaway? TOS is rarely random. It's a perfect storm: anatomy, injury, and movement habits all colliding in a tight space. Knowing what sets the stage helps you or your clinician tackle the root cause head on. Let's say you're at the doctor's office describing all these odd symptoms, but how do they actually confirm it's thoracic outlet syndrome and not something else? Here's where special tests come in. There's no single magic test, so clinicians use a series of provocative maneuvers, each designed to stress the thoracic outlet and see if symptoms reappear. For instance, the Roos Test, also called the elevated arm stress test, has you hold your arms up and repeatedly open and close your hands for 3 minutes. If your symptoms resurface, it's a strong clue for neurogenic TOS. Then there's Adson's test. Turn your head toward the affected side, take a deep breath, and see if your pulse fades or symptoms worsen. That's checking for arterial compression. Similarly, Wright's test and the Costoclavicular Maneuver involve arm and shoulder positions to pinpoint where things get tightest. You might be thinking, are these tests reliable? Excellent question. On their own, they're not perfect. Each has limitations. But When doctors combine multiple tests like Adson's, Roos, and Tunnel's, studies show diagnostic sensitivity shoots up to 94%, meaning you're far less likely to get a false positive. So, next time you hear about these special tests, think of them as detectives zeroing in on the culprit through clever clues and body positions. Alright, let's talk solutions. Because the good news is, most cases of TOS can be turned around with targeted physiotherapy, not surgery. So, what's the game plan? It's all about decompressing that crowded tunnel by correcting posture, stretching, and building muscle support. Step 1 is postural re-education. If you're hunched over a laptop, imagine someone gently pulling a string from the top of your head, aligning your ears over your shoulders and pelvis. This simple adjustment starts to open up the thoracic outlet. Next, stretching. Tight muscles like the scalenes and pectoralis major can act like vice grips on nerves and vessels. Think of corner stretches, placing your arms on a doorway and gently leaning forward, or neck side stretches, holding for 20 to 30 seconds each. These lengthen the trouble spots. But stretching alone isn't enough. Strengthening the middle and lower trapezius, rhomboids, and serratus anterior muscles keeps your shoulders back and chest open. Start with light weights, 2 or 3 kilograms, and focus on high repetitions, like scapular retractions. Think of this as building the scaffolding that keeps your tunnel open. Add in breathing exercises like diaphragmatic breathing to relax accessory muscles, and nerve gliding techniques to keep those nerves moving freely. Manual therapy and range of motion work round out the toolkit. The overall message: consistency is key. Daily practice, gradual progression, and avoiding symptom-provoking activities are what transform TOS from debilitating to manageable. So, how long does it take to see results, and what if things don't improve? Most physiotherapy programs for TOS span about 6 months, moving from pain management to more advanced functional tasks. Early on, you'll focus on ice, rest, and modifying your activity. Think of this as putting out the fire before rebuilding. As symptoms ease, you'll progress from simple table or floor exercises to standing routines, then to overhead tasks like reaching or lifting. The technical term here is graded progression, meaning you only move up when your form and pain levels allow. But what if you hit a plateau? Sometimes adjuncts like posture garments, night splints, or even muscle relaxants are needed. In rare, stubborn cases, especially with blood clots or arterial problems, injections or surgical decompression might be considered. Here's a key insight. Exercise alone isn't enough. It's the combination stretching, strengthening, postural correction, and consistent technique that rewires your body for lasting change. Daily practice and regular check-ins with your therapist keep you on track. So, whether you're dealing with TOS yourself or helping a loved one, remember, recovery is a marathon, not a sprint. But with the right tools and persistence, most people can reclaim function and leave those symptoms in the rearview mirror.